Right now, medical staff from the U.S. Army are in Houston helping to alleviate a strained hospital. They're operating a wing at United Memorial Medical Center in Acres Homes. This is video of them arriving to their assignment earlier this week. I had a chance to talk to Dr. Joseph Varon, the chief medical officer at UMMC, about this much needed support.
It's been so hectic and unbelievable at the hospital. For yourself, explain your current working situation.
I mean, I've been doing this for 119 continuous days. I've been working 16 to 20 hours a day. And we have been doing that because people are coming in much sicker than what they were before. And it's very difficult to find anybody that wants to work with COVID patients. Nurses, respiratory therapists, even doctors, they refuse to see COVID. But it's a very serious situation.
What are you noticing that's different about the patients today with COVID versus earlier on?
It's interesting that you mentioned that. And what I'm seeing that is that patients are coming to me 10 times sicker than when they were before. It's the most important theory is that these people are waiting too long. People are scared to go to the hospital. They think they're going to die in the hospital or they're going to catch COVID. So by the time they come to me, they've had 2, 3. We had a guy that had 5 weeks of symptoms.
You've gotten some help from the United States military and an Army unit that has moved into the hospital there. Explain to us how many personnel and what are they doing to help support you and your staff?
And that's a great question because this is my first time in my life where I actually get to work with the Army. They've been amazing. They came in 85 individuals, nurses, respiratory therapists, a few doctors. And what they're doing is we know that we're going to be getting many more patients. We know that we are going to be flooded with patients. So we allocated an entire unit for them, a unit that can host up to 50 patients.
Doctor, what do you think it will take to turn this around?
Education. Simple as that. We can fix this. We can fix this. The way to do it is social distance, wear your mask, wash your hands. It's very simple. Closing the state without education is not going to help you. We have to educate people. People need to be socially responsible. And this is a true war. It's a war that I have against COVID and a war that I have against stupidity, because people are still doing things that they shouldn't do outside. If you can convince your viewers to simply follow those easy rules that I talked to you about, we have a very good chance to flatten the curve and be okay. But if we don't do it, we're going to have a gigantic second wave in October.
How concerned are you leading into the fall? I know there's been a lot of talk in the medical community about flu season while also in the midst of a pandemic. What are your thoughts on that?
I'm very concerned about the fall, but I think that we still have time to control that. We have a few months where if everybody does the right thing, we will be okay. But we have to do the right thing. And I apologize, I get so passionate about this, but it's a truth. I don't want more people to die. People are dying unnecessarily.
And you can see much more of my interview with Dr. Varon on our KHOU 11 YouTube page.